Okay, phase one of the back arm was simple enough. Now let's move on to perfecting phase two of the back arm, the slotting phase. In phase one, we learned to turn the elbow up. In phase two, we're going to learn to turn the elbow down to the ball while keeping the hands in virtually the same place and position, meaning located in front of the shoulder with the palm on the pitcher and the barrel of the bat stacked on top of them. In phase two, the long bone in the upper arm is turning in the opposite direction it turned in phase one. To turn the elbow up, it was turning in, or internal rotation. Now to turn the elbow to the ball, it turns in the opposite direction. It's turning outward, actually, external rotation. The back elbow will begin to turn up as the back leg is loaded. It will continue to turn up as the back leg presses laterally to the front side. Just before the front heel drops, the long bone in the upper arm will reverse its direction and start to externally rotate, and the elbow will begin to slot. It is imperative that the hitter trying to perfect his swing work hard on loading and slotting the back arm with his hands in relatively the same place and position that they started in. This universal pattern is easily seen in the catcher's throw. As he's getting the ball out of his glove, we have internal rotation. But then to get the ball back, to create lag, the bone is turning outward in the opposite direction. So again, inward rotation, and then it reverses and lays back, outward rotation. Try the catcher's overhand throw for yourself with a baseball arm trainer attached. Turn the bone up, and then feel it reverse its direction as you turn it past your ear. The obvious difference here is that as the catcher's bone turns outward, it stays at about the same level, and the ball raises up before it lays back. For the hitter, again, the bone is also moving outward, but it's moving down towards the ball as well. And it's the hands that have stayed in the same place. Notice the palm on the pitcher and the very steep bat. Really try to feel where these movements are similar between the catcher turning the ball past the ear and the hitter turning the elbow to the ball with the hands staying in virtually the same place. The infielder's throw is just like the catcher's throw in that as the bone begins to turn to lay the ball back, the humerus stays high even with the shoulder and the ball moves up. Again, for the hitter's throw, the hands stay in the same place and it's the elbow that drops down. Almost all professional infielders wind up throwing sidearm, but the elbow never drops below the shoulder. The hitter's throw is also sidearm. They're just a little bit different in how they get there. So again, here's the back arm action that you're trying to develop. The bone turns up, or one, and then the elbow attacks the pitch, or two. Again, elbow turns up for one, elbow attacks the pitch for two. Notice how he didn't attempt to straighten the back arm. The elbow stays very bent through this phase. The palm still facing the pitcher and the hands have not traveled. The barrel is stacked on top of the hands with the elbow underneath. Again, load and attack. Next, we will move on to our drill series for phase two of the back arm. Again, throughout the entire session, it's a good idea to have the belt and the stride trainer attached, and always on phases 1 and 2, the arm trainer should be attached. The hands back device is also highly recommended for use in training the first two phases of the swing. The hands back device will assist the hitter in keeping the hands back in front of the shoulder during the loading and slotting phase of the back arm. The resistance band is attached to the lead wrist and can be extremely helpful to a player who is rushing his hands forward or flying open on the front side as the elbow attacks the pitch. The barrel trainer can also be utilized while training phase 2. The hands back device provided assistance to the hitter. The barrel trainer creates resistance that the hitter must work against to keep the barrel in the proper position. This strengthens the hand and arm and ingrains the proper hand and barrel position. 1, 2. Our grip position is very important, as both wrists should be extended outward and not cupped inward at this point. The top hand should be in a position to where the palm is still facing the pitcher if the hand were open, and not cupped inward facing towards our chest. Same with the bottom hand. The wrist should be extended in a position that the palm is facing the catcher. Again, hands extended outward and not cupped inward. In phase 1, when we were using just one arm, we used the out of the glove action. In phase 2, we're going to take that lead hand and attach it near the back shoulder. During all of the drills for phase 2, the front side should remain square or closed in a highly similar position that the front side started in the stance, meaning the front foot is square, the front knee is still square, the front hip is still closed, the front shoulder is closed. As the elbow slots, you should feel some slight tilting rather than turning at the front shoulder. In addition, both feet are pointing straight ahead. We will use a nearly identical sequence as we did in phase 1. The only difference is that I prefer going barehanded for phase 2 over using a football or baseball. Again, utilize the one-arm bat and both hands on the regular bat. And with each implement or bare hand, we'll do 3 isolation repetitions and then 3 repetitions with a live stride, preferably again against the live motion. And here your cadence is 1, 2, or load, attack, 1, 2, and then 3 repetitions with the live stride. 1, 2, load, attack, 1, 2. Next we'll pick up the one-arm bat and isolate the movement. Again, no stride first for 3 repetitions. We really want to focus on just moving the humerus and feel the bone or elbow turn up, and then feel the elbow turn to the ball while the hand stays in front of the shoulder. 1, 2, load, attack, 1, 2. And again, we'll add a stride to the movement, performing 3 repetitions. With the stride trainer attached, it'll assist you in allowing the back leg to be in charge of pulling up and putting down the front side, as well as staying closed on the front side. We should still be closed on the front side, remember, after the elbow slots, and feel more tilt than turn in the front shoulder. 1, 2, load, attack, 1, 2. Next we'll go 2 hands on the regular bat, and again start off with 3 isolation repetitions with no stride, and we're only moving at the shoulder joint, the back arm. 1, 2, load, attack, 1, 2. And just like the other sequences, after isolating the movement for 3 repetitions, we'll add a live stride for 3 repetitions. 1, 2. Again, we're matching up nicely with our elite level major league hitter. Elbow has worked towards the ball, bat stacked over the hands and over the elbow. Load, attack. We really want to feel that bone turn up and to the ball. 1, 2. Again, very important to feel that elbow attack the baseball. The loading phase doesn't have to be too big. There needs to be some turning up. It doesn't have to be gigantic. 1, 2.